Good morning. All right, folks, we're going to get started. For the first time, I'm going to try to not be like 15 minutes late when I'm getting started because I know we just get delayed and delayed further as the day goes on because there's so much good conversation that happens throughout the day. Welcome. It is so wonderful to see all of you. For those of you that do not know me, my name is Susan Hwang. I'm a neonatologist, also one of the steering committee members for Chosen Quick, and I am really, really excited to welcome you all here today for truly a wonderful day of learning, conversation, and collaboration. This is the agenda for today. It's pretty packed, hence we're gonna try to stay on track. I'll be starting off with some opening remarks. Our State Representative Chris DeGruy will be joining us shortly, so I may just proceed to provide our chosen update until he arrives. We'll also receive updates from Illuminate Colorado, as well as our Colorado Perinatal Care Quality Collaborative. We have our lived experience expert with us here today as well from Hard Beauty. I'm very excited to hear from her and that group. We'll have a short break, and then we'll have our two keynote addresses from Doctors Nancy Young and Tori Metz. We'll have a 45-minute lunch. We'll have a presentation then from Poudre Valley Hospital. I can't wait till you hear from this hospital team and the amazing work that they are doing up north in Fort Collins. Following that, we will proceed into workshops. And so I hope by now have selected the workshop that you'd like to participate in. And those same workshops are then repeated. Therefore, you should be able to participate in 2 out of the 4 workshops today. All right. So let me get started. First of all, I want to say that there is so much happening globally, nationally, and locally, not in a good way. And it feels very overwhelming, and I feel very much helpless at times. My conversations with my children are very much filtered because I'm not quite sure what they understand and don't understand. It is overwhelming, and there's so little that we can control. But I was so excited to wake up this morning and come here because this is a day that we have control over what we learn, how we converse with each other, and how we then take what we learn and translate it into action, practice, and program change. And so I feel very much emboldened about what will happen here today, given all the other stuff that's happening outside of this building at this moment. Shown here are the 5 key values that were put forth by the White House Executive Office of the President, the Office of National Drug Control Policy. And I share these because these are very much the values of Chosen and Chosen Quick. And I want to read them because this is our starting point. This is the common space where we will begin. 1, having SUD in pregnancy is not by itself child abuse or neglect. Criminalizing substance use disorder in pregnancy is ineffective and harmful. Everyone has the right to effective treatment. Pregnant women with SUD should be encouraged to access support and care systems, and barriers to access should be eliminated where possible. Improving coordination of public health, criminal justice systems, treatment, and early childhood systems can optimize outcomes and reduce disparities. So these are our values. This is where we are starting from. And our hope is that the content that you hear today and the actionable steps that you all put forth are in line with these values. The approach that we take is very much like the one that's put forth by the RAND Corporation, the ecosystem approach. Here they're highlighting opioid policy, and I would say it's policies around perinatal substance use, that we are truly breaking down silos and that we are enveloping families that are affected by substance use with supports and services that come from all these domains. And while we are currently on a medical campus at present, it's not about hospitals. It's not only about healthcare systems, but how do we engage with criminal legal systems, using harm reduction approaches, thinking about social determinants of health, of education, employment, housing. And so really it's about a multidisciplinary cross-systems approach to best supporting our families affected by substance use. And really, we are still in it. There is an ongoing crisis. You probably recall a few years back, I showed a similar picture of maternal mortality rates and causes of pregnancy and maternal associated death. But this was an earlier period. This was from 2012, I believe, to 2015. And yet it has not changed. This is the most recent report that was put forth just a few months ago. And still, the leading causes of pregnancy-associated and pregnant-related death in our state are suicide and unintentional drug overdose. So there is so much to be done. And while these numbers are bleak, I know that we are all here because we're so committed to understanding the barriers and facilitators to these numbers, and really also hearing the stories, moving beyond sort of quantitative and the numbers, but really understanding experiences of families, but also of providers, frontline workers. Those are continuing to support these families in various organizations that we serve. And with that, I am both relieved and happy to see Representative DeGruy here. I thought I was going to have to just keep on talking until his arrival, but it's really my pleasure and honor to introduce our state representative, Chris DeGruy, who is the chair of the Opioid and Other Substance Use Disorder Study Committee in our state legislature. He represents Colorado's 30th House District, which is Jefferson County. His other areas of interest, all relevant for us and for today: environmental policy, tax policy reform, election systems, and healthcare payment system reform. He was first elected in 2016, and currently he's in his fourth and final term. Thank you so much for joining us this morning.
Thank you. Well, thank you all so much for having me this morning. I'd like to think I have many virtues, but punctuality has never exactly been one of them. And I, for whatever reason, just never think about what time I need to get in the shower so that I can actually get out the door and the time to get across I-70 from the other end of town. So sorry for being late. I'm really excited to be here this morning to talk a little bit about what we've been doing on the Opioid and Other Substance Use Disorders Interim Study Committee for the last several years, and to talk about the role that organizations like yours have played in helping craft better policies that will be really meaningful for babies and families in Colorado. So, as was mentioned, my name is Chris DeGruy Kennedy. I'm in my fourth and final term in the State House representing Lakewood. And when I first ran for office, I don't know that I had a clear vision of what all the things are that I would be working on. You know, I think there's a lot of people that they decide when they start their career, I want to serve, I want to help people, I want to do something that's really meaningful and impacting people's lives. And there are a lot of different paths you can take to doing that. I think there are some who kind of get involved in doing work with people one-on-one, where you can make a big difference in someone's life, whether you're a doctor or a social worker or a variety of other things, a teacher. You know, you can really shape people's lives very directly and in a profound way. And for whatever reason, that never felt like a great fit for me. I think that it's hard and it's personal. And I think, you know, when I've done things like visited the Jeffco Human Services office and heard some of the stories of what folks deal with, I'm just so grateful for the people that are able to do that kind of work every day. And for whatever reason, I kind of gravitated more towards the macro, thinking, if I can help make better policy, if I can help fund programs that are meaningful, then I can help the other people who are doing that one-on-one work do their jobs better. I can help improve, like give them the tools they need to do that work and try to impact people's lives in that way. So I kind of chose policymaking for that reason. I think one of the things I didn't necessarily understand when I ran for office was that my job is not really to be the expert on anything. And this is especially true. We're a part-time citizen legislature, right? I used to be a structural engineer. That has literally nothing to do with the work I do now. And there are a lot of people that have similar, you know, kinds of backgrounds that don't really directly relate to the work they do at the legislature. I'd like to think we developed some expertise over time. I've certainly dug into a lot of research and learned a lot of things in my 7 years in the State House. But really what I've learned over this time is that my job is to be a connector. My job is to listen to the people who know what they're talking about and make sure that people who need to hear that do the right thing. And kind of figure out where politics and policy meet to try to play my part in making things happen. There are very few policies that I've passed in my time of the legislature that were my original idea. There were a couple, and I'm really proud of those because there were things that I kind of took from the beginning and moved them along. But more often than not, it's things like the work we've done on the Opioid Interim Committee, where we hear from dozens of organizations like Illuminate and others that have this experience in the field that are seeing a problem firsthand. And they come and tell us, you guys have to do something about this. And here are our ideas for how you do that. And so sometimes you have a variety of different ideas that may be competing with each other, and you figure out how to build some agreement on what those ideas may look like. Sometimes it's just an idea that no one ever thought of before. And you say, all right, let's do that thing. And then let's figure out how to do it. And it can be a little bit tricky, but the work that I've gotten to do with Illuminate over the years, I really feel proud of. Not that I really even understand all of it, to be totally honest with you. We do a little bit of divide and conquer in our work on the legislature. When I was first appointed to the interim committee in the summer of 2017, the child welfare component, the working with families and babies, was not really the place that I specialize necessarily. I got to vote yes on a lot of good policies. There were a couple times where I'd like to think I played a part in advancing the conversation by bringing the people together, but really, I was just a proud supporter in the background rather than a mover and shaker in some of these policies. The things I tended to get assigned were, I never thought I would do this. I never thought I would spend so much time working on insurance policy. Insurance bores me to death, and it always has. And I never want to deal with it with my own health insurance plans and all that stuff. And yet it's so important. It's so consequential. And so this is something that I've done a lot of work on over the years. And I remember meeting Jade and some of the others at Illuminate in my first summer on this committee. I got to meet Lex earlier this year when she testified in front of our committee. But there were a variety of things. It's been every year. This is now the fourth summer this interim committee has been meeting. And every year, Illuminate has come to the table with ideas saying, let's do this thing, or let's do these 5 things, or let's do these 50 things, but these 5 for this right now. And I think we've had a pretty good track record over time. There have been a few of the things that took a couple years. There were some things that are challenging. I think that for people that don't understand substance use disorders, there is this tendency to want to punish, to think of people with substance use disorders as the other. And I may not describe this with perfect accuracy because it's been about 5 years since I thought about this policy, but I remember grappling with this question of when a child is removed from a mother based on substance use exposure, and how problematic that was for the evidence-based policies that we know can help that mother and child build a healthy and functional relationship, and how that mother can build a sustained path to recovery where both the mother and child are better off, because we decided that being punitive was the wrong approach, and focusing on healthcare and social care and connection was really what we needed to be doing. And fixing that policy was kind of hard, because there were a lot of people that were worried about the politics. Oh my God, we're just going to let these, I'm not going to repeat the stigmatizing language that was used by some who opposed those policies at the time, but it was a hard bridge to cross. And that's just one example of the kinds of policies we've been able to pass by virtue of the advocacy of people like you and your presence at the Capitol, and you're forcing your state legislator and legislature to pay attention to these issues that really matter. Like I said, I didn't really expect this was going to be a place I spent so much of my time and energy when I first ran for office, because I did not have a lot of connections in my personal life to substance use disorders. I didn't have family members who had dealt with substance use disorders, at least not in a way that I was aware of. And so when I served on the committee in that first summer, it was because Brittany Pedersen, who is now a member of Congress, but at that time was a state representative, decided the state of Colorado really needed to shine a brighter spotlight on these issues. And Brittany and I just so happened to represent neighboring districts. We lived a couple of miles apart in Lakewood. I had been friends with her husband from once upon a time. And she asked me, she said, I'm starting this committee. We need to do some big work in Colorado to try to tackle every part of this where we've been lacking, from prevention and harm reduction to treatment and recovery to interactions with the criminal justice system. And I'd like you to partner with me on this work. I said, great. I don't know anything about it. I would love to learn and help. And that summer I was unmarried, unattached. I had all the time in the world. So I was able to just drink from the fire hose for 3 straight months. And I learned so much about this policy. And since that time, it has really been probably one of the most significant parts of the work that I have done in the state legislature. But also since that time, I did develop a personal connection to it. In 2018, I met, fell in love with, and married someone. Her name is Kira, who had dealt with her own substance use disorder issues in her teenage years. At the time I met her, she had been 7 years sober, but it had had a profound impact on her life. And as is common with many, there's a very serious trauma interaction that happens. My wife is a rape survivor from her early teenage years, and that was one of many factors that contributed to nearly a decade, starting as a very young person, of pretty serious substance use. And when she got sober, it was because her fiance at the time died of a heroin overdose. And, for some people, that is what it takes to get sober, having a loss like that in your life, or having a near loss like that in your life. And the reason I'm telling this story is, I think, even for a person like me, who I like to think of myself as an ally, as an empathetic person who has tried to help people, even if I don't have a direct connection to my own life, you still see things and learn things when you develop those personal connections that change the way you think about substance use disorders. Kira had gotten to know a number of people through AA, through a variety of other programs she was a part of, who had their own substance use struggles. And many of them were not as successful as she was at maintaining her sobriety. And I have been to several funerals for overdoses in the last several years. And, we have this tendency to think about stigmatized populations, underserved populations, as the other. They're not like us. They're not like my family. There's something different. There's someone else. And when you do that, you don't always relate to the kinds of solutions that make a difference. One of the funerals I went to, I think I was struck, and this is after I had done work on this policy and heard this testimony in summer committee meetings, I was struck by how much like me this guy was who had died of an overdose, how similar his life experience was to mine. And I kind of expected that when his parents spoke, that they would be talking about the devastation and whatnot. And, yes, they were devastated, of course, by the loss of their son. But what actually came across was kind of the joy and the celebration of who he was as a person over the course of his life. And I remember his dad describing him as magnificent. And just that has stuck with me for years now, hearing this father kind of celebrating the life of his son and thinking about all the joy his son brought into the lives of all these other people that he knew, even while he was struggling with a very serious substance use disorder that ultimately took his life. And I think for me, that was kind of a revelation that helped me realize that when we work on these policies, it's not the other. It's all of us. Maybe you didn't have it in your immediate family, or maybe you didn't hear about it, but this is not about a population that is unlike us. This is about things that impact all of our lives. This is about a disease that impacts the brain. This is about, a broken system in our country. I would say that, economic opportunity and the lack thereof has been a major driver of a lot of people's substance use disorders. I would say that healthcare systems that have at times been more punitive rather than restorative have been contributors to these problems. And I think that, I feel inspired in our present moment because I see the trajectory we're on. It's kind of amazing how big the problems are, and it's easy to feel hopeless by how big the problems are. I remember when we started talking about these policies that we had this gigantic gap in access to treatment, and we still have a gigantic gap in the access to treatment. And yet the difference between then and now, just over 5 or so years, is pretty profound. Maybe not millions, but thousands more Coloradans have access now than they did before, because we have just kept our foot on the gas and kept trying to move forward in every way we can. And I think that, it is hard to feel hopeful at times, but I think there's a lot of reason to be hopeful because, at least at this moment, and I think for the foreseeable future, we have a legislature, we have a governor, we have local government officials across the state who care deeply about these issues and want to partner with organizations like yours. And of course, the work you do that's, well beyond how public policy is driven, about the partnerships you develop in communities. I think that is actually so much more profound than any policy I've ever had a chance to vote on, because what I do just creates words on a page in a very long set of books that are our revised statutes of Colorado. But it means nothing without the humans that are out there doing this work, the humans that are creating connections like your collaborative and the voices you bring to the table to try to advance this conversation in Colorado. So I'm really honored to be here to just help you celebrate this work, to help encourage you to keep doing it. And, I only have 1 year left in the legislature, but I intend to make my mark. And I'll tell you as a closing note, my wife that I talked about before is running to be the next state representative from my district and will be an even bigger champion than I am for these issues. And I'm so excited that she'll be able to continue this work and maybe in a couple of years, chair this committee that I am now chairing and help you advance these policies into the future. So thank you again for having me this morning. And thanks for all the work you're doing every day. Thank you so much. Yeah, my pleasure.
Thank you. Thank you so much. I really appreciated your sharing your personal story and being vulnerable with us. I also appreciated that a politician said that he was not the expert, that he learns from others. The humility is not that common nowadays. So much appreciated.